Good afternoon. We are here with Dr. Frankovich for the Friday, April 24th media availability. So we'll just launch right in. The LA Times recently covered a report by the California Department of Public Health titled California SARS-CoV-2 Pandemic Healthcare Surge Crisis Care Guidelines. This state report lays out guidelines on who gets intensive care in the event that resources are limited and suggests, among other things, that giving younger patients priority over older patients is an ethical justification that will, quote, give individuals equal opportunity to pass through stages of life, end quote. Will Humboldt County be following these guidelines?
So yes, I'm aware of the guidelines, and I was actually really grateful that the state provided those. There are lots of frameworks for making these kind of decisions, and I think we can all agree that what we don't want to happen in the event that there was sort of a catastrophic shortage of equipment is to be able to have doctors at bedsides trying to decide what they should do. So the whole idea of these frameworks is to give people the chance in advance to really think about how do we allocate resources if they are scarce. And so it's an important discussion to have, and I appreciate having another framework to look at. Area hospitals, all hospitals have their ability to manage this internally, and they are generally guided by ethics committees who take all of these considerations in to their decision making and then try and put something in place to help their staff. And so our local partners, I do know, are looking at sort of all these ethical guidelines, and you know, hospitals do this all the time, not because of the reasons here today with COVID, but because of other issues that come up around ethics in hospital settings. So it's an important thing for us to be able to look at, but it does not determine what a hospital does.
Thank you. Based on the slides from Thursday's public dialogue, we saw 40% mitigation with a peak later in the year. If the county eased just some of its shelter-in-place order, how would that change, and what percent mitigation would it be?
So it's the million-dollar question. And kind of the reason that we showed the two graphs, one with the 40% mitigation, which is what we have right now, and one with nothing in place. And the idea is to sort of, for people to understand that as we move forward, it's very difficult to know right now what each thing we do will do to that curve. We know it'll have an impact, but we're going to have to be watching carefully to know what the impact is. And so what I would tell you is that we've asked the state for additional modeling on this. We've looked at additional modeling on this, but the best we can do is try and adjust things for if we did, you know, this percent more or this percent less. But unless you can tag that with what the intervention is, it's not very helpful. And so again, it's the reason that a lot of this is uncharted territory, and the massive importance of being able to monitor our population through testing so that we can know where we are on the curve.
Are we looking at opening the county based on public health science or based on economic need, and how are those balanced?
Well, again, as I mentioned last night, you know, the two things are not mutually exclusive. Public health uses that social determinants of health lens to look at everything, which means it's not only infection that we look at causing illness or death, it's also societal things, economics, poverty, education, all of those things that impact the health status of individuals in our community. Other things, race, ethnicity, all of those issues come into play. So it is not a simple health or not health. Health is integrated in all these things. So we'll be using all of that as we look at this going forward. And again, it's a balancing act, we know. There are consequences on both sides. Inaction, action. And there's no way to stay exactly where we are. So we're going to have to just keep balancing those as we move forward.
Okay. How are officials going to enforce the facial covering order?
Well, again, this is an important tool for us moving out of shelter in place, and as we start to make that plan, it's going to help keep us all safer out in the community. We believe that it's an educational piece primarily. I think people in the community want to keep each other safer. I know it's an inconvenience, as you can see from my mask. It's a pain right now. This one isn't particularly good, but it's important. And again, that idea that my mask protects you, yours protects me, we're in this together. So enforcement, if people are non-compliant, certainly is possible. But like many things we've been trying to do during this pandemic, we've been trying to use education and getting people to understand how what they does impacts the health of their community.
Many essential employees are wondering if they are supposed to wear facial coverings inside the building when at work, but still 6 feet apart.
Yes, is the short answer to that. And the idea of that is that we all share the environment, right? And so as we are masked, even if, if you have your own office that no one ever uses, no one goes in, that's sort of a different situation that we could think about. But most people don't have that. And so if you're in a shared work environment, masking helps to protect everyone in that environment.
Thank you. We're told Humboldt County Public Health has set up a priority system for providers to follow when submitting COVID-19 tests, with priorities 1 through 3 samples tested at the public health lab and priority 4 samples sent to a corporate laboratory. Mm-hmm. Can you explain the criteria for each of these priority levels?
Well, what I tell you is we've been using priority levels all the way along. It's the only thing you can do, especially when you have a limited resources, right? And so these, we've altered these as we went. Initially, we were using the strict CDC guidelines. As we built capacity, we started to open things up. And so there have been many versions of these over time. Currently, the state has provided a guidance document for prioritization, and so we are actually in kind of a state of flux on moving to that. I can give you examples. Priority 1 would include hospitalized patients, symptomatic healthcare workers, people identified in contact investigations, which are important for us to get, and cases or potential cases in congregate living facilities or correctional facilities, obviously because of outbreak potential in those facilities. And then we move through priorities 2, 3, and 4. Priority 4 is typically community-based testing of all low-risk asymptomatic people and surveillance tests of all asymptomatic people. That's where we want to be in terms of our testing capacity because it gives us a wealth of information, but we do have to prioritize until we have full-blown access.
You said Wednesday that you expect it to become increasingly difficult to accurately report the number of COVID tests conducted on local residents and negative results moving forward. How might this complicate public health's efforts to see more comprehensive testing and surveillance testing, which you said are key components to incrementally reopening society moving forward?
Well, you're right. I mean, it's been a frustration for us. We want both the denominator, we want the total number of tests done as well as the number of positives so that we can see how much of our population has been tested. What I can tell you is that, the state has been working with public health overall on this because it really has to be a mandate for the companies to get that reporting in. And so we've all been pushing to keep that reporting reliable and timely. But again, as these smaller point of care operation tests where people are doing them on site in their facilities come on board, as other new providers come on board, getting everyone to sort of follow those recommendations and rules as they're put out is sometimes a learning curve. And so I think our point in this is that, at the beginning we had a fairly high level of sort of confidence in those numbers, and it's less so right now at this moment for us.
What are the specific supply chain issues for each of the various COVID-19 testing components, from swabs to specific reagents, that have so far made it infeasible for the Humboldt County Public Health Laboratory to expand testing capacity to the point it can loosen testing criteria and test mildly symptomatic or even asymptomatic people?
So when we look at this test capacity, you're right. There's been enormous issues with our supply chain between things like swabs, although we've done pretty well in that arena, and transport media to hold the swabs in, as well as reagents for our equipment to be able to do testing. The governor's task force, I think, has actually done a really good job at being able to sort of shake loose some of those supply chains for us. And so we have found in our own internal lab that we've had increasingly more reliable access to the reagents that we need. And so that's really been an enormous help for us. We also are really in close conversations with the state on some testing support that I think is actually going to make a lot of this much easier for us. And we'll report out as soon as we have further information on that.
Thank you very much, Doctor.
Thank you.